Guys, it's Jamie, and in this video, we are talking about chart notations. So this is a very quick, easy topic. It's just going to be a quick way to visually represent things on your chart by simply drawing on it. It's very quick, very easy to learn how to do this. So let's just get right into it. Okay, so to make chart notations, you want to be in a patient's chart. And this icon right up here says chart notations. So if you click this, you first want to make sure that this is checked. Always view notations. If this is unchecked, it will not show any of your notations when you pull up the chart. So I always have this checked on. So it's always going to show any notation. And then we're going to go to edit notations to add something new. So this is very simple. It brings up this little toolbar. You can select the thickness, the color. You can change all of this. It's very, very simple. And you can just draw on the chart. In my office, we use this a lot for like night guards. So if a patient has an occlusal guard, we might draw something that looks like a little arch. So this just indicates at a glance if this patient has an occlusal guard. I've seen offices use it to put like a lingual retainer so you know that this patient has a lingual retainer. You can use it for a supernumerary tooth. You can change the color so you can have different things mean, different colors mean different things, but you can, notate down here, there's a supernumerary tooth. Whatever makes sense for your office to make things as easy to see at a glance as possible. So chart notations, they're very rudimentary. This is not anything fancy or special, but just kind of a quick way to make little notes on the chart so that you can always see them just at a glance. And you can see there's just different options here. So you can highlight stuff. You can change whatever you want. Then the eraser, so you can remove things, just delete this off, delete this off. And then when you're finished, you can just uncheck edit notations. So you can see all of these notations stayed, but I'm no longer in editing mode. This is very useful for offices that want to be able to see things at a glance. That is something I'm really big on, to be as efficient as possible. I don't want to have to look through a bunch of clinical notes or progress notes to see if this patient has an occlusal guard. I just want to be able to look at their chart and see, oh, they have an occlusal guard. Oh, they have a lingual retainer. Oh, there's a supernumerary tooth notated here. Anything that there's not already a visual representation in Dentrix. So conditions, obviously existing restorations, things like that. You want to actually chart those using your procedure codes or your procedure button. But anything else that it does not show up visually on your chart, you can do this way by using chart notations. Okay, so you can see that chart notations are super simple. There's not much to it, but it's a good way to just give yourself the ability to see things at a glance visually on the chart. So if you're a hygienist and you're looking for more tips like this and you want to learn more about Dentrix, I have an entire playlist I will leave here that goes through everything that dental hygienists need to know about Dentrix. If you go to my channel, if you're an assistant, administrative team, doctors, office managers, I'm working on building out full playlists for your roles as well. So there will be a full playlist for each role within the dental office and everything that you need to know about Dentrix. I also put out new dental tech tips and tutorials every Friday. So I will see you guys in the next video.